Good afternoon, everyone. My name is Marissa Weiss, and I'm from the Lymphology Marketing team here at JOPES. Thank you for joining us today for our webinar series. Our topic is fibrotic tissue and will be presented by Karen Ashforth. Karen is an occupational therapist and certified lymphedema therapist. She's very well known in the lymphedema community nationally and internationally. Her passions include lymphedema equipment invention and development, treatment of underlying fibrosis and inflammation, and treatment of complex and difficult cases. We hope you find this webinar interesting and informative. Please note that this is a recorded session. We will not be taking questions at the end. However, you can direct them to me and I will help get them answered. Additionally, we hope you join our email blast to find out about our next monthly webinar. Next month will be a patient webinar. We are very excited to invite patients for a live webinar to talk with someone who is a certified lymphedema therapist and a doctor. She specifically works with those affected by lymphedema after breast cancer. More details to come. Thank you again for joining us for this webinar, and I will pass it over to Karen.
Hello, and welcome to Fibrosis. I love talking about all the different ways of treating fibrosis because it's a very important component of lymphedema treatment. It's present in all stages of lymphedema. It's present in primary and in secondary lymphedema. And I believe that compression garments are a core lymphedema treatment that is easy to incorporate antifibrotic components in both the clinic and the home compression programs. The discussion points for today's lecture are going to be an introduction and overview of fibrosis, taking a look at Foldy's stages of lymphedema and how fibrosis is identified there, looking at the definition of fibrosis, the different types, and our goals for treatment. Then we will move on to talk about the types of compression garments and pads and how to grade them for aggressiveness of treatment. We'll be looking at elastic flat neck compression garments, the Alvarex. We'll look at a cushioned flat neck compression garment, which is the Relax, the quilted chip foam compression garments and pads, the Jovi Pack, and then garments such as the Belise and the Ferro Wrap that can increase the effectiveness of compression over these. And lastly, we'll talk about the Jovi Pit Packs. When we look at the stages of lymphedema, we can see that fibrosis is present in every single stage, even stage 1. So let's back up a little bit and talk about what is fibrosis. It's an abnormal thickening of existing tissue and an excess fibrous connective tissue. It damages the lymphatic system because it impacts the lymphatic circulation like a barricade. We don't want to just decongest our patients. We want to address the underlying blockages so that we can increase lymphatic circulation. When you treat fibrosis, it's going to influence your current lymphedema practice and the long-term prognosis for your patients. So although early treatment is best for long-term outcomes, I've seen positive changes in my patients who have fibrosis for 20 or more years. So I wouldn't hesitate to incorporate it at any point of the treatment. So let's bring this down to a real life example. This woman, it's very easy to see that she has lymphedema, but along with swelling, she also has fibrosis, which is affecting and worsening her swelling. I'm going to talk briefly about 5 different types of fibrosis, and this woman has each of them. I've identified 2 basic categories of fibrosis, which is a soft, thickened tissue, fatty tissue, and a hard type of fibrosis, which is a type of scar tissue. So when we look at her arm, we can see that she's definitely swollen. But after doing decongestion, she's still not going to have an arm that's equal to the size of her other side. There's going to be some fibrosis left, and that is a fatty tissue. In addition, this woman has had breast cancer surgery, so she has surgical scar tissue, both superficial and deep scarring. She underwent radiation, so she has radiation-induced fibrosis. And unfortunately, she had a cellulitis infection. So she has some hardening of fibrosis as a result of that infection. And lastly, this poor woman also has cording or axillary web syndrome. And I'm going to briefly touch on each of these 5 types of fibrosis so that you can get a picture of how they're affecting her and how they're affecting your patients. So first off, lymphostatic fibrosis, which is that soft, puffy fibrosis you see in her arm. It is present in all stages of lymphedema, and it's created from lymphostasis. In the early stage, the edema thickens to a gel-like substance. And then in the chronic stages, it can become harder and thicker over time. It can create a woody fibrosis, which I see in different places. Most commonly, I see it at the toes and the malleoli, but I've also seen it in arms and other parts of the body. Håkan Brorson has identified in his studies that the subcutaneous fibrosis that he extracts in liposuction is 10% thickened lymph and 90% fat. So in the course of swelling, the swelling starts to attract fat molecules and the tissue actually changes. I tell my patients it's kind of like a coating inside a pipe. It's a buildup of tissue and it never goes away unless it's removed surgically, but we can soften it. So the surgical fibrosis that she has in her chest post-mastectomy, it started out as a wound that took 3 weeks before the scar tissue even began. And after 3 weeks, then the collagen fibers began to cross-link and form the scar matrix. The typical maturation time for scar tissue can be up to 2 years. So there's a lot of opportunity for influencing the scar during that time. As I mentioned, surgical scar tissue can be both superficial and deep. So when I'm looking at treating surgical fibrosis, I really palpate carefully after I decongest to look at the extent of the damage. The deep scarring can and does occur in different locations than the superficial scar. In addition to the lymphostatic and the surgical fibrosis, because she had radiation, she also has a radiation-induced fibrosis. Radiation therapy alters the tissue composition and it makes it thinner, harder, and more brittle. And there are all sorts of different mechanical factors that are used during the radiation treatment that influence the damage. The type of radiation, the duration, the intensity, the amount, and the locations of the radiation field. And there are also patient-oriented factors such as skin sensitivity and type, tissue density, and composition. So although we cannot see her radiation fibrosis, it's there underneath her camisole. As well under her camisole is the post-cellulitis fibrosis, because this woman unfortunately had an infection after surgery at her surgical wound. And so when a person has cellulitis, it's an acute, intense congestion of fluid, and there's a high density of solids, which include infectious wastes. And what this does is it can form a dense and woody area around the infection site, and it can harden over time. Some patients are vulnerable to multiple infections and reoccurrences at the same site, so it can kind of snowball and make the tissue worse and worse. We also can't see in this picture that she has cording, which is also called axillary web syndrome. And these are visible and palpable cords of tissue that can create discomfort. They can restrict range of motion and function. And typically you find them between the axilla and the cubital fossa, but you can see them in the entire upper quadrant, including the trunk and all the way down to the hand. So now that we've talked a little bit about what fibrosis can be, let's talk about our goals. So I'm having difficulty advancing a slide. There we go. Okay, so our goals for treating fibrosis are to decrease the swelling so that we can get to the underlying fibrosis and treat it. We want to decrease pain. We want to increase mobility and increase function. Each patient is different, and each patient has different needs. How do we use all these garments out there? I often will use an antifibrotic pad or a garment just by itself, or if I want to add a little compression, then I have many choices, and we'll talk about all of these things. The way that it works is that there are uneven surfaces on the fabric or in the garment that create a micromassage to fibrotic tissue, and they can create an increased tissue flexibility and extensibility, which in turn promotes lymphatic circulation. This next slide talks a little bit about how to grade the antifibrotic compression. So we'll start on the left-hand side, and you'll see that I'm looking at 3 different categories of antifibrotic garments. The first being custom flat knit, the second being quilted foam, and the third being the pit pack. So I have arranged them in order of aggressiveness for fibrosis, with the custom flat knit being the least aggressive. So if you look at the second column, it's telling you the types of compression that you can use over the antifibrotic garments on the left side. So under custom flat knit, I put elastic because it is elastic and it is its own compression. But you can also use elastic over a quilted foam garment. And the Jobst Jovi packs have jackets, and you can also use Ferro Wrap if you want to be a little more aggressive. Bandaging is even more aggressive because you have more layers, and pneumatic compression I would consider to be the most aggressive of all. So going back over to the left column, now we're going to look at the Jobst pit packs, and because they are more aggressive, I use a less aggressive compression as a rule. So looking over at the right column, I would use a compression garment for the chest or thorax, or some other type of elastic external compression, or you can even put a pit pack under quilted compression. So let's go over the different types of garments, starting with the Alvarex flat knit compression. The advantages are that it is less bulky and more functional. It's more comfortable to wear, especially during warm weather, but the disadvantage is that it's less bulky, and so it's less effective. So the bulkiness works for it and against it. It's a good daytime garment. And when we talk about elastic compression, it comes in 2 types. It comes in circular knit and flat knit. We're not going to discuss circular knit in this lecture because most circular knit provides only compression. It does not have an antifibrotic effect as a rule. But the custom flat knit is thicker, has better containment than circular knit, which impacts fibrosis. And the flat knit fabric has a weave, which has an antifibrotic effect. It's 4-way stretch, it's a custom order, and for leg compression, you can get a class 1 through a class 4. In the arm, glove, and toe caps, you can get a class 1 through a class 3. So there's quite a variety of compression to choose from. I would say that flat knit is most appropriate for lymphedema stages 2 and 3, but bulk is better for edema control and fibrosis. So when we need something that's a little more aggressive, then we look to the more bulky garments, which would include the Relax nighttime garment. This fabric also has a built-in antifibrotic weave, and it comes in lower leg and thigh compressions of class 1 and 2, and the arm sleeves have a compression of class 1. This is appropriate for all lymphedema stages. It's thicker, it's lighter, it's less bulky than quilted compression, but it's more bulk than elastic compression. So now we're going to talk about the chip foam pads and garments. And now you're looking at a picture of a Jovipac nighttime garment, which is used for the arm. These originated from the Schneider packs, which were little pieces of cut up foam that they were put in stockinette and then put underneath the bandaging to create a focal area for helping with swelling and with fibrosis. What's nice about these garments is that when you wear them, as you move your body, you have a muscle-aided massage action. And you can couple them with external compression, as I mentioned before, to increase the aggressiveness of that. The pads can easily be tucked into an existing garment, and they are very effective used over time. You can get something as simple as a small round quilted pad or a custom sleeve, which is like this. This is a very ultra custom shoulder torso sleeve, which I use a lot with my patients, and this is very effective for cording. It is very nice containment, excellent for fibrosis, and you can customize where you want the quilting to be. This particular example does not show quilting on the torso part, but you can specify where and what direction the quilting lines so that they can direct fluid, and it's wonderful to be able to customize this. So some of the things that will grade the effectiveness of this quilted compression are how thick the garment is or the pad is, because you can get it as thin as a mini pad, or you can get something that's very bulky, that is thicker than the foam that we use when we bandage patients. And the density of the foam can also be controlled. You can use a very, very soft foam for someone that has frail skin, or you can get a combination of different types of foam all in one garment that can create a variable surface. So unlike the first two garments that I mentioned, the Elvarex and the Relax, that have the built-in weave in the fabric, this has an anti-fibrotic effect because of the foam that is inside the fabric. So depending on how thick it is, depending on the density of the foam, that can make a big difference in how aggressive your treatment is. I want to just mention that other types of foam, such as the flat foam we use in bandaging or waffle foam, are not as effective as the chip foam. And the reason is that they are softer, they're less aggressive, they flatten over time when they're compressed. So this choice of the chip foam is a lot more durable and effective. I have my patients sometimes wear them during the daytime. This is an example of an Ina boot, which is a combination of the chip foam garment, and then over it is a Velcro wrap, which is built in. And I will have patients wear these around the house like Ugg boots. They have a non-skid sole, and they're wonderful. They work very, very well. And so although many garments are used at nighttime that are quilted because they're so bulky, there are times when wearing them during the daytime can be a good thing. And as I mentioned before, using them during exercise to increase the effects is good. You want to look at the time, the amount of pressure, and the frequency, and select these according to the patient's individual characteristics, which would be the amount of edema that they have, the amount and types of fibrosis, the skin integrity, their body mass, and just how they respond to a trial of this type of compression. So I want to mention head and neck specifically because this is a very challenging area to treat. Oftentimes these patients will have had radiation, and the radiation fibrosis is particularly difficult with head and neck patients due to the shallow tissues and the difficulty accessing internal tissues. There can be potentially life-critical functional limitations with these patients in terms of swallowing, aspiration, and breathing. And there's a reverse gravity advantage disadvantage, meaning that at nighttime, unless they sleep sitting up, they're going to have swelling that will be worse in the morning, and that will create more congestion. And then during the daytime, as they are upright, then they drain naturally. So for these patients, it's particularly important to have a good nighttime program. I'll often encourage my patients to sleep on an incline, but using this chip foam garment that you see here is a great opportunity for nocturnal compression. And the quilted lends itself very well. It's very comfortable. It's very easy to put on and take off. And the patients really see results in the morning. Many of my patients don't like the idea of wearing elastic compression during the daytime on their neck or on their face. And so wearing something at nighttime can sometimes be enough, especially if they're doing their manual lymph drainage during the daytime and exercising. That can see them through if they have a lot of head and neck swelling. I want to talk a little bit about some examples of thoracic compression. And here you see on the left, it's a post-lumpectomy pad, because you can see that it forms around the remaining breast tissue. And then on the right is a post-mastectomy pad. And these are wonderful for dealing with surgical scarring and radiation-induced fibrosis. They create this very gentle micromassage as the patient breathes in and out, which over time can really help to soften tissues. And you can also see that these pads have little extenders that go up into the axilla. So they're great for axillary congestion and scar tissue and cording. So I love using these with my patients who have a lot of issues in the axilla. This is the Belize compression garment, which has pockets that can accommodate special chip foam pads. And this is a wonderful garment to use because you can see that it's high cut in the axilla and it has a long margin down the thorax. So it covers a lot of area, and there's a lot of opportunities to insert chip foam inside this to help to remodel and affect fibrosis and swelling. This is an example of a ferro wrap, which can be used for the arm or the leg. And if you have a patient that needs a higher level of external compression, this is a great alternative to bandaging because it's so quick and so easy to put on. And you can adjust the amount of compression that you use over the quilted anti-fibrotic garment. Now we're going to talk about my very favorite type of anti-fibrotic treatment. This is the pit pack, and I'm proud to say that I invented it. It is basically either a single row or a bean bag with cherry pits inside. And the beans create this wonderful anti-fibrotic effect. It's very aggressive. When I came up with this, I was looking for something that was more aggressive than quilted compression with the foam. I wanted something that could really work that hard woody fibrosis. So this is not something that you would use with just any patient, but it can be very, very effective in the right situation. So as you can see, you've got quilted bean bags or single row technology. And sometimes I'll use the bean bags to substitute for prosthetics because they're lightweight, they're affordable, they fit right into the pocket in the thoracic garment, and they can create an anti-fibrotic effect while they're being worn. But the single row technology is good because it's easier to wear underneath clothing, it's less obtrusive, and sometimes I'll use that in combination with a breast prosthesis. I'll put the pit pack in the pocket of the bra or the thoracic compression garment, and then that'll be the closest to the patient, and then the prosthesis goes on top of that. How many people here use prosthetics as compression for the breast? I think that it is a very important thing to include in treatment because many patients have overlooked breast swelling, and this congestion can lead to fibrosis, which is something that is very undesirable and unhealthy because it can snowball additional congestion. Going back to the pit packs, I want to just caution you we'll talk about precautions, but patients that have frail or insensate tissue need to be approached very carefully with this. You need to do a very short trial period and frequent monitoring. And you can slip a little pad under elastic compression. Sometimes a patient will have a place on their arm or their leg or their torso where there's a focal area of fibrosis. And so sometimes even just a little pad under an elastic sleeve or garment can be very effective for that. They are very aggressive when they are used under bandaging or with pneumatic compression. But I will say that one of my favorite treatments is using pneumatic compression with either a pit pack or a chip foam pack. If someone has the skin integrity and are appropriate, then it can be very, very effective. Another advantage of the pit packs is that they don't degrade or compress like foam over time, and there's no chemical off-gassing, which a lot of the foam has. These are some more examples of the pit pack. This is a wonderful half circle. This is great for post-mastectomy, post-lumpectomy scars. I've often taken 2 of them and just whip stitched them together to form a full circle, which is really nice for a lumpectomy. This is a crescent, and I use this a lot on toes. And you can use it under elastic or quilted or wraps or even pneumatic compression. And again, you want to be really careful with your patients to observe the precautions, but this is great for those woody toes. Here's an inframammary pad, and this again is very, very effective for women that have undergone breast cancer surgery. So you can actually make pit packs into garments, and they come in half cylinders or full cylinders that can go around arms or legs. And this is a garment that I designed for one of my patients who had a very fibrotic arm. You can see this is being modeled by someone else, but you can see that the patient had a pretty high body mass, a lot of fibrosis, and she just struggled with the circulation in her arm. And so she actually used this underneath pneumatic compression, and the 2 modalities together were so effective in keeping her arm soft and helping to decongest her arm. So as I mentioned, with the pit pack, you need to be very mindful of precautions. You want to be very, very, very careful and avoid using them if you have frail tissue. This would include recent surgery, chemo, radiation therapy, so be very careful. You want to also look out for bony prominences so that you don't irritate the underlying tissue. And I would be very cautious with patients who have disturbed sensation. Sometimes I'll have people wear them at nighttime, but I like to establish a daytime tolerance. So I'll have people wear them in the evenings and make sure that they're comfortable before they wear them all night. And like a splint, I would wear them for 30 minutes, take it off, check the skin, wear it for another 30 minutes, check it again, because it's really important just to make sure that you don't have any irritation. So I'd like to mention a study that I did 10 years ago using the beanbag style pit pack. And what I did was to gather a group of women who went through lumpectomy surgery and radiation therapy. After their initial assessment, I taught them manual lymph drainage, and they wore elastic compression for 2 weeks. And then they received treatment with the Jobst pit pack. I used 3 different types of assessments to look at the effectiveness of this fibrotic treatment of the pit pack. So I used a tonometer to measure their tissue density. We looked at cosmesis, which is the individual's perception of their cosmetic appearance of their breast, and it was rated by each patient using an analog scale. And then I looked at pain with a pain analog scale. The results of this study were that there was an average of 4.58% of tissue density decrease after conservative treatment, but a further decrease of 14.71% after I added the pit pack. The cosmesis was improved by 13.3% after conservative treatment, but it jumped to an improvement of 47.86% after I added the pit pack. Breast pain was improved by 50% after conservative treatment, and when I added the pit pack, it rose also to 66.67%. I should add that all patients were very happy with their treatment, and at that point, using the pit pack became a standard of care for patients who are appropriate in my clinic. So what you're looking at right now is the poster that I presented at the International Congress of Lymphology in Australia in 2009. And I ended up publishing it in the British Journal of Lymphology. So I'd like to sum up this talk by saying that each patient's home program needs to be reevaluated periodically to make sure that program is meeting their needs, and it needs to be adjusted as they change. So who can tell me which patients need fibrotic treatment? All of them. Keeping in mind these great garments, we can help our lymphedema patients with both swelling and fibrosis at every stage. I want to thank you so much for attending, and please feel free to follow up if you have any questions.